It's Hillary and we're here at Full Metal CrossFit, and I wanted to talk to everybody about the role of trigger points in back pain and what happens when they can actually pull ribs out of place. And I'll get to that in a moment, but what actually brought this up was I had a couple athletes come to me last week and they said they had some trouble breathing. During their workout they had a little bit of chest pain and it was hard for them to take in a deep breath. And so what I had asked them was, of course, do you have asthma? And that's a really important factor to keep in mind. Please, athletes, if you have a history of asthma, if you've had an asthma attack, if you have trouble breathing, maybe it's seasonal allergies, please tell your coach and let them know. If you bring your puffer, of course, and let them know where the puffer is located so they can deliver to you if you need it. But that was the first kind of triage question I had. The second one that we had to start differentiating was with trigger points and whether or not they had actually pulled the rib out of place, because what can happen is your muscles in your back can get so tight that they can actually pull improperly on your ribs, and so you can have a muscle imbalance and it can pull the rib out of place. It can be mildly dislocated. We call that in the industry a subluxation. And so what happens with that is you actually have to go see somebody to get that reset. I've treated people for this before, for dislocated ribs or subluxed ribs, and you see them when they are laying on their stomach. You see that there's a difference in the height of their chest. So I actually see the chest wall a little bit higher on the side with the subluxation. And so a simple adjustment can help fix that and provide immediate relief. The biggest symptom or the biggest red flag for this is the hurting to breathe. You can't expand your chest the whole way because of that rib being out of place. Again, so it's a simple fix. People who can do this are your friendly neighborhood chiropractor or your naturopathic doctor. Hint, hint, wink, wink, nudge, nudge. So what causes this? So when you have trigger points, it's basically a ball of disorganized muscle tissue. And what happens is that it uses up energy in a bad way. It causes the muscles to move incorrectly and it pulls on other muscles, and it can cause the rib to actually shift out of place. So I'm just going to remind you guys, we're going to go to the floor and I'm going to remind you to smash your back muscles to treat these trigger points, because these trigger points can be treated by a massage therapist, they can be treated by a naturopathic doctor or an acupuncturist, they can be treated by a chiropractor, anything that helps to release all of that unnecessary muscle tension. But what you can do at home would be to take care of your back muscles. So I'm going to get on the ground and I'm just going to put this ball on my back in the muscles either above or to the inside of the shoulder blade, and I'm going to roll until I find that big knot. Colloquially, we know trigger points as knots. So you're going to feel that in your back. It's going to feel really tender, and it might radiate. The pain might travel maybe to the front of your shoulder, as it is for me right now. It could travel up into your face. So just hang out on that spot. If it's really banded and the muscle is really ropey, then the ball may actually try to slide off. So try as best as you can to just compress that muscle. And just move your arm a little bit up overhead and then across to the opposite hip. And you can repeat this until you feel a little bit of a release in the muscle, which will likely take longer than that. So that's it. I just want you guys to do a little bit of prehab or some self-work, at home or a few minutes early in the gym, just to prevent things from happening like subluxation, and to keep on top of the trigger points, because we all have them from overuse, and there's something definitely to be aware of, especially if you're an athlete and you're lifting a lot of weights. Trigger points happen, so I want you to take care of them. That's it for now, guys. See you next time.